Well before the coronavirus hit our region, Charlotte Taylor wore a mask to work at the King County Courthouse to protect herself. She's at high risk of catching infectious diseases.
So that's the chemotherapy drug. I put it in the bag to remind my daughter, who has to give me the injections.
Taylor has asthma and an autoimmune disorder that requires weekly chemotherapy treatments. With a state of emergency called, last week she asked her bosses if she could work remotely instead of at her courthouse cubicle scheduling interpreters for people who don't speak English. She even supplied a doctor's note saying she has medical conditions that put her at increased risk for COVID-19. Please allow her to work from home. And the response?
The request was denied.
It's people just like Charlotte Taylor that public health officials are urging to work remotely if possible. This is Jeff Duchin, King County's top public health doctor, at today's news conference.
By taking steps now and acting together, we're not only reducing our personal risk of exposure and transmitting this disease, but we are reducing the risk of severe illness for those who are most vulnerable in our community.
The same county pleading with employers to do everything they can is telling this worker she needs to come in.
They don't seem to care, and it's as if they have some kind of ulterior motives. I'm sorry. Like they have some kind of ulterior motives, and it's not a game. It's my life. Right? And it's such an easy fix.
Her courthouse supervisor said it wasn't so easy. They wrote she had to come in to assist in-person customers, print invoices, and make real-time scheduling adjustments. But Taylor says 99% of her job is right in front of a computer, creating schedules over the phone and online. Today is her very last day of paid sick time and vacation.
I need to work. I'm the only worker in my house. And this is my last day. So after that, I'm starting to take cuts to my pay. Then what? Not afford my rent? Not afford my medicine? You know, it's not good for me. It's not okay. It shouldn't be acceptable. It shouldn't be acceptable.
Of course, we've reached out to the King County Superior Court administration about this odd case, but they haven't gotten back to us just yet. And Charlotte Taylor has been there for a long time, 17 years working in a department known as interpreter services for people that need help, understanding what's going on in the courtroom. It's an important job.
It seems to go directly against just what we are hearing from county officials today.
I know.
Yeah, how could it happen?
She thinks that this is retaliation. She has been a worker who has complained. They've had investigations because of her complaints inside that office. But even if that is the case, obviously it's no time to be risking someone's health, and that is her point. And she says she even already has a laptop, so she could just plug in and go.
So she'll be forced to keep going to work to keep her job?
She's not going right now because she's too afraid, and her doctor says don't go in. So she's hoping that the county will, in her words, do the right thing and make an adjustment for her. And this is one case, but I think it's a really good note for all employers, right? All employers in the region. You heard the public health officials today urging employers to do what they can to keep people, especially vulnerable workers, at home.
And to accommodate their needs
Yes.
at a time like this.
Keep us posted, Susannah. Thank you.
Yeah, for sure.